COVID-19 has disproportionately affected the elderly. In March and April, when hundreds of people were dying every day in northern Italy, many of them in nursing homes, the country was lamenting the loss of an entire generation of grandparents. Despite lockdown measures across the globe, the age-related tragedy has been echoed in so many countries. The death toll is higher for the elderly, but it's becoming increasingly clear almost anyone can become infected and be a carrier, even if they're not showing symptoms. Now, after analysing 6 million cases between February and July, the World Health Organization says it's younger people who are spreading the disease.
The epidemic is changing. People in their 20s, 30s, and 40s are increasingly driving its spread. Many are unaware they're infected with very mild symptoms or none at all. This can result in them unknowingly passing on the virus to others.
With over 20 years of experience in communicable disease control and infectious disease management, senior clinical lecturer at the University of Exeter's Medical School, Bharat Pankania, joins us now. Bharat, thank you. When we're considering the age of people who are spreading the disease the most, do we have to make a distinction between those who are becoming infected and those who are actually getting COVID-19, the disease?
No, we should consider everyone and every place as a potential infectious hazard. We can't sit there and say, Group A is more infectious, be careful of them compared to Group B. That is where mistakes happen. So if you take the line, and I said this in 17th of March this year, consider everyone, every person, every place as potentially infectious. That way you are more precautionary. What I would say about the 20, 30, 40-year-olds that the WHO report was saying a few minutes ago is this is known. We have known about it. We've known about it for many, many, many months. Therefore, this message should have gone out a lot earlier with the lifting of the restrictions, because we need to tell 20, 30, 40-year-olds, you might be okay from infection, but you must be careful because you'll bring it home to your elderly parents and grandparents.
Yeah, that's where your expertise in infectious disease management comes in, Bharat. You see, the thing is, in the UK at least, I know that's been said. And I believe also in other countries where leaders have told those who are younger than 40, remember, you may not die from this, but you could give it to people who live in your house who are more vulnerable than you. Does it require more regulation? Because words don't seem to be enough. Personally, walking around London while I was on my way to work over the past few months, I was regularly seeing groups of, they looked as if they were in their mid-20s, 6 or 7 of them all together and clearly not related.
I totally agree with you. We need to be a lot firmer, lot more consistent messages. And these messages need to emphasize, don't get infected, don't infect others. And one more thing, which we learn, there may be a COVID-19 syndrome. And with a COVID-19 syndrome, it means some people, these young people who get infected and get better, may actually go on to develop what I call COVID syndrome, which is long-term tiredness, fatigue, neurological symptoms, heart condition, kidneys affected, etc. So you might get better, but that doesn't necessarily mean you're not going to get a COVID syndrome. Best advice possible, don't infect others, don't get infected.
Many countries around the world are struggling with what to do about opening schools again. What is your feeling about schools? And I suppose I'm really talking about universities as well. But we're talking about children who could be as young as 11. Primary schools in some countries have had much more success in socially distancing their pupils. But then when you come to secondary school, you come to universities, you're talking about much, much bigger numbers than primary or kindergarten schools. How is it possible to keep that age range safe?
So the first thing that we should do and accept is be honest. And the honesty is infections will happen, infections will go up. Pointless, absolutely pointless pretending it's not going to happen. So that would be the first step. The second step is between now and schools opening, for all the managers, all the teachers, and all the important people in these institutes to practice what we are going to do. And my advice is, you're going to have a drill. You're going to come to school. We're going to check you out. We're going to ask you a few questions, and we're going to tell you what you're going to do. And we're going to make sure you wash your hands. We're going to make sure you've got good washing facilities. In the UK, many schools don't even have good hand washing facilities with warm water. So we've got to do all those things, and at the same time, accept infections will go up.
Bharat Pankhania, thank you so much for sharing your expertise with us and our viewers.